Hi, everyone. Thanks so much for joining us today. We'll get started in just a minute, just waiting for a few more folks to hop on. And in the meantime, let's go ahead and warm up the chat. So there is a chat button. It's going to be at the right-hand side of your screen. You'll see chat Q&A polls and handouts. So if you want to go ahead, let's go ahead and pick. I know summer's right around the corner. There's probably a couple fun vacations maybe you had in mind, or maybe even just a bucket list destination spot. Go ahead and put in the chat if you have any vacation plans where you might be headed. Selfishly, I might be looking for some vacation ideas myself. So go ahead and put in the chat couple vacation spots. Hawaii, Italy, anything fun. It could even be a bucket list item. So let's go ahead, put it in if you have any plans coming up this summer. Nothing, no plans. Italy, Hawaii. Gosh, where's another place I'm thinking? Yeah, over in Europe. All right, we'll give it maybe one more minute and then we can probably go ahead and get started. I know my family's headed to North Carolina, so if there's anyone East Coast on the call. I know that's a popular spot down in the south area. All right. I think we have a bit of a crowd here, so I think we can probably go ahead and get started. Well, hi everyone. Welcome to today's webinar, Connected Care for ABA Practices, Aloha ABA and Ensora Data Collection, formerly Catalyst in Action. My name is Marissa and I'll be introducing today's session. We're excited to show you how the integration of Aloha ABA and Ensora Data Collection can simplify your practice. So excited to go ahead and hop in. And just a few housekeeping rules to get us started. This webinar is going to be recorded, so we'll go ahead and send up a follow-up email with a link to the recording as well as all the resources we mentioned and we refer to during this session. And if you have any questions, again, on that right-hand side, there's a chat. There's also a Q&A tab, so just make sure that you're putting any questions you have at any point during the session just specifically in that Q&A tab on the right-hand side of your screen. And we'll try to answer them towards the end of the webinar. We might not be able to get to all of them, but we'll try to follow up afterwards. And just to note also in that handouts, we'll have a couple special offers and promotions. You'll definitely want to check those out. I know those will be sent again at the end, but make sure you check out that handout section. And I think with that, I'll go ahead and kick it off to our guest speakers. I'm really excited to introduce today's speakers. I know we have Tina, Tina Klauber. Sorry about that, Tina.
You got it.
Klauber, so Senior Account Executive at Aloha ABA. I know Tina combines her hands-on clinical experience as an RBT with in-depth knowledge of billing, scheduling, and practice operations to help ABA providers optimize their workflows. And we also have her joined by Angela Tiberi, Solutions Engineer at Ensora Health. Angela is a BCBA with over 8 years of experience in ABA, using her clinical expertise and technical knowledge to help practices improve through technology. Angela and Tina will walk us through the integration, showing you how these two platforms work seamlessly together and streamline your workflows. And I'll go ahead and pass it over to Angela. She's going to walk through connected care in action.
Awesome. Thanks, Marissa. So yeah, just to cover quickly kind of why we partnered, how we got here before we jump into the demo. We kind of listened to the market. We heard what you all wanted. We want to support ABA providers with connected and flexible tools, give you all the options there, and kind of reduce manual work, streamline your clinical and admin workflows between the two systems. So what this means is between Aloha ABA and Ensora data collection, formerly Catalyst, we'll have more connected care, improved operational efficiency, and then the freedom to use your preferred practice management system with our leading data collection solution as well. So we'll be going through how those are going to connect today. And then just quickly about Ensora Health, who we are. We're the leading healthcare technology partner for mental behavioral rehab and AVA therapy providers. And Ensora data collection as the industry's most trusted tool for capturing clinical data. So across the board, we have over 28,000 practices, 89 million clients, and 200,000 providers. And then I'll give it off to Tina to talk about Aloha.
Thanks, Angela. So Aloha ADA is a practice management software. We streamline scheduling, billing, payroll, and reporting, essentially trying to reduce a lot of the admin burden in your day-to-day efficiency. We are focused on product, we're focused on service, and we have a huge emphasis on customer support, which is very essential when you are handling a software in this kind of market. And we're here to support you in doing exactly that. Today, we are going to be walking through the demo of Aloha and Ensora. So we have our full agenda here on the screen today. Reminder to put any questions that you might have into that Q&A chat, which should be on your sidebar. And we're going to go ahead and dive in. Okay, so we're going to start over on the Aloha side, building out a client profile today. We're going to be showing how to add an appointment into our schedule. We're also going to pop on into Ensora, take some data, create our session notes as if we were a BT, and then we'll pop back into Aloha and actually bill that appointment out. So we're kind of going to be walking through a lot of different roles within the organization and seeing where these systems happen within the respective sites. So let's go ahead and get started. So first, I went ahead and shared my screen to the Aloha dashboard. So the dashboard is the very first thing that you see when you log into your Aloha system. It's essentially a bunch of different widgets that gives you a good overview of your site. So I'm going to point out a couple of widgets here that we like to zone in on that we find provides a lot of value to our organizations. First being your expiring staff qualifications widget. This is showing you any staff qualifications coming up on expiration in your site. We also have an expiring authorizations widget for your kiddos. So any in the next 30 days that are coming up on expiration for those auths will pop up here. We do have a couple of billing related widgets here on the dashboard as well. So your unbilled appointments widget is going to be showing you any appointments that have gone unbilled within the last 30 days. This is helpful to make sure things aren't slipping through the cracks. We also have an aging report, which shows you your amount billed versus your amount outstanding each month. So amount billed is what's going out. Amount outstanding would shrink as you are getting payments back in. Canceled appointment summary is showing you any cancellations in your system. So we have a couple going on for May right now. Keep in mind, these are cancellation statuses that are customizable. So we have two really basic ones here, but you can customize it as you need. Your bottom three widgets gives you an overview of your own schedule. So if you were to set permissions for a BT maybe, where they log in and see a limited amount of items, they can log in their dashboard. Maybe they're just seeing their week, their day, and mileage if you track mileage. So this is that initial dashboard screen. What I want to jump into first inside is going to be your client's profile. So inside a client profile, we're going to kind of walk through what an auth build out looks like and a general demographics and fields within that client system. Prior to this, now keep in mind, I would have already built out a payer and I would have built out a staff. So payer setup is going to be where your fee schedule lives. So modifiers, billing codes, rates, and then your staff profile build out will be where basic demographics live, pay rates, qualifications, things of that nature. So inside my client's profile, we're looking at Bugs Bunny. We have our basic demographics, any customized additional demographics that you'd like to track in Aloha. These are just examples. We also have a contacts card, so any family members, guardians, school teachers, whoever you want to add in as a contact. You also do have portal access as an option. This essentially allows that person to log in, view their child's schedule. They can also see any client balances from that portal. And if you're wanting them to make payments towards those balances, we do have a Stripe integration. So Stripe would allow them to put in a credit card and actually make a payment towards something like a copay or a deductible. You can also assign staff to the kiddos caseload, and you can group people to teams within the organization. So maybe that is caseload teams or region teams, anything within your organization where you need to start grouping people together. Authorization tab, I want to focus in on this here because this is going to pull us into our schedule in just a bit. So any policy information is first going to go in here. We're looking at an insurance policy for this example, but keep in mind if you have regional centers as a payer, school districts, private pay, you can add those in as well. And then the authorization is going to be right underneath. So when you're looking at setting up an authorization in Aloha, you are essentially telling the system how to bill this appointment by setting up all of these billing defaults. So that way your staff doesn't need to remember CPT codes or diagnosis codes. They only need to remember the service that they are providing. So looking here at an authorization, our auth number goes at the very top. Our date range lets us know when we can schedule for that service. The service name gets pulled inside. This is a service name that you would have customized when you built out your payer. So when I see assessment here, the actual billing code, rates, modifiers, etc., is going to all live on the back end. It's going to pull inside. We'll set our allowed limit here. This is going to be used to track utilization, which we'll see in the schedule. And then we have those billing defaults. So this essentially, again, tells the system how to bill. But if you needed to make changes to these defaults, you could at scheduling levels or at billing levels. And we'll see those at both places. Then we have our next service in, and it's going to be built out the same. So that's what your auth looks like. You also do have a cabinet area, which is where you can put in any files or documents for your profile. Every client has their own cabinet, every staff, and every payer. I want to jump into our schedule next. Inside of our schedule, we're going to start to see what the actual integration looks like with Ensora. So I'm excited. First, I want to kind of give you an overview of what we're even looking at here. So this is for one staff member at a week perspective. Over on the left, you have your appointment types, and these are seen through these icons. Billable appointments will look like this. Non-billable time, things like trainings, meetings, onboardings will be a blank clipboard. And then any break time, lunch times will be a coffee cup. Drive time or mileage is a car icon. We track both, but if you just wanted to track one or the other, you totally could. Over on the right, you have your status bubbles, which lets you know if the appointments are completed or not. So completed is a filled in circle. It essentially means that these appointments are ready to go to billable if billing if it's billable, ready to go to payroll if it's payable. We're going to notice this in our integration. And then our open circle means it's not yet completed. You can also see utilization here on your schedule by single clicking on any billable appointment. So if I were to single click on a billable appointment, I can see the overview of the actual appointment itself. So this is Elmore as my client's assessment appointment. We can see total auth, 50 units in the auth for this one. And then of that total, what's been scheduled versus not. Of those that have been scheduled, what's completed versus not. So that's going to be what your utilization build out looks like on the schedule. So it's really handy. So for today's integration, we're going to be creating our appointment with Bugs Bunny, pushing it over and actually creating data on it and creating our session note. So I'm first going to double click where I want this appointment to be created. We're going to do an afternoon appointment, add in my staff and clients. We're going to put in Bugs. Once I selected Bugs, all of the authorized services are populating. So I'm selecting the service name that I want to create my appointment for. And it's going to pull in all of my auth information and payer information behind it. Then I'll put in my date, start, and end time. I can put in my location here as well. If I needed to repeat this appointment, I do have a repeat tool. It's going to look like this. Very handy, just looks like a Google Calendar repeat. I can even use the auth end date to actually end my repeat. And then I'm going to save it. This is going to pull this appointment over into Ensora, which is where our BT is taking our data and creating our session note. I'm going to stop sharing and hand it over to Angela.
All right. Thanks, Tina. So I'm going to go ahead and share my tablet screen. So I'll be like the BT or the staff that's working with the client, ready to go in and collect data, take my session note, and have that sync back over to Aloha. So I'm going to open up my Catalyst app. I will have a unique PIN that I'll log in with here. And then from there, when I log in, I'm going to see any students or clients that I've been given access to on this left-hand panel. So you can see Bugs Bunny that is there. And then on the bottom here, you'll be able to see any appointment. So that is the appointment that Tina just created and saved. We can see that I'm working with Bugs Bunny today. You can see the date and the time and the actual location of that appointment as well. And you can too go and look at other days. So if I want to go back, I could look at yesterday. You could see these are all past due. If they were completed session notes, they would be green and it would say completed. So you get that feedback once it syncs with Aloha as well. So that to say, I'm going to click on Bugs Bunny, and then we typically will just go straight to this all targets screen to go ahead and start taking data on this client. couple things to point out first are that you can also work out of just baseline or just maintenance as well. So you could click into those screens instead. And then also there is an offline mode. So if Wi-Fi goes down or you got in the community or what have you, you'll be able to take data offline as long as you need to. Once you're back online, then it will all sync. So I'm going to go to all targets here, and I'll be able to start taking data on the programs we've already set up here for bugs. So all of these would have been already set up by the behavior analyst or the lead on that case, whoever is setting up their program. So you can go through and take data. You'll always be able to see your SD, your target name, a program name, and then any target instructions that you add. And then depending on the target type you select, you'll see different options here. So what we were looking at before was DTT, but you could see this as an example of a task analysis. You can do forward or backward chains too. So if you do either or, the steps will just be grayed out. So you can set up all different target types. And then as you go through and collect data on them, you'll see on this left-hand side where the bottom left corner, it says washing hands 1 out of 5. I had 5 desired daily trials. I've done that one time. I'll get that input, that visual input there, that I've gotten a fifth of the way through how much data I should be collecting in this session. And then if you do have a learner with a lot of programs, you can also keyword search for targets or programs in here, so you can always go and quickly find something if needed. And everything is very customizable. So even for DTT, for this example, I could have different prompt codes here. I could also do prompt fading, so you can set up a lot of different prompt schedules and those types of things. And then anything frequency will also live on the bottom of this main screen. So you can see that I was already in here earlier taking some data, but where it says kicking, there's 6 data points. I can just tap that to take more frequency on that behavior. If I take too much, I can click the circle and take that back. And then if you look across the top of the screen, in the top left, the behaviors tab is where all of our behaviors we've set up to track will live. So you can take ABC, all of those different recording types are on the bottom. So for ABC, you can take the data that you're seeing at the top, you don't need to. You also then can just add in your ABCs. If you see something new, you can also type that in to start tracking something new. And then you'll be able to add notes if needed as well. As far as frequency, you can see those data points that I already took on the main screen, just another area to track that frequency data. And then if you have duration set up, you can always just start that and toggle around screens. You're never stuck on any of these screens. For partial interval, you also can set it to beep 10 seconds before the interval ends, just to remind your staff. And then momentary time sampling can also give you a pop-up as well. So on whatever interval length you set it, you'll get a pop-up when that interval length is up. And then as far as trial sheet goes, so there is the web portal. That's where I was mentioning a lot of this stuff would happen. A lot of times the behavior analyst will be in there kind of analyzing things and editing programs and viewing the graphs. However, you can also go into this trial sheet view to view the data you've collected so far that session. So under like the motor imitation using objects, you can see it's at 33%, and you can see the data points that I collected, and you can click in and actually view graphs from here as well. So you can always access graphs from this bit in addition to the web portal. And then SOAP notes, I will jump into. So in terms of actually then when you're completed, you finish taking your data, it's time to collect your session note. You'll be able to come into this tab and create SOAP note. You can see previously saved notes, and you can also save notes as drafts as you work on them. And then when I click create SOAP note, I have a lot of demo templates in here. You will just see whatever templates you've created for your staff, and you can assign different staff types, different templates. So you might have like a BT template for 2 different BCBI templates. Each person will just see whatever templates are relevant to them. So that's what they'll see here. And then they can select their template and go ahead and start working on that. So the first thing you'll see is the date. So we already have our date, and then the session is going to be selected to actually match with Aloha. So it'll actually then match that appointment, and then Tina's going to pick that back up in a minute to actually see what happens to push that to billing as well. So from there, you'll be able to add in your start and your end time. So I'll add in my start and end time here. I'm sorry, was it 10? I think it was 10 to 12. If not, there's also an option for fixing a mismatch, so we'll do that. If it grabs your location, you also can have that automated. You can do free text, you can do signatures, you can do multiple choice, multiple select. So whatever you've pulled into your template is what you're going to see here. And then the asterisks are required fields. So I'm just going to add in a little note, the word notes, just for the sake of time there. And then from there, I'll add then this and click publish, at which point now it's going to pull the data collected in that session into the note, save it in Ensora, in our backend, and then it's also going to push that to Aloha to match with the appointment and then generate billing. Before I completely hand it back over to Tina, there's a few more things that are built in here. You also can keep sort of like anecdotal notes. You can view any documents. You can push documents in. You can complete fillable assessments and take videos. All these features can be like safeguarded as well. So if you don't want videos, turn it off. A lot of different permission settings. So yeah, I will hand it back over to Tina then to show what happens once that session note is saved and pushes into Aloha.
Okay, so I am resharing my screen. Now we are back in the Aloha calendar. The BT or RBT is done. They do not need to come back into Aloha because everything has happened for them over here. First thing that I like to point out from the exterior view is our completed bubble is now filled in, as well as a new symbol popped up. This symbol is letting me know that there is a session note that came over from Ensora into this appointment. So I can see that from an external view. Hey, I have a session note or a SOAP note that came over. Inside of this billable appointment, there's a couple of updates here as well. First, we have our signature that was pulled over from our SOAP note. The staff signature is showing is pulled over with the time date geotag. And if we were to collect client signature, that would come over here as well. The start and the end time also were pulled inside. This does have a time syncing feature. So if Angela were to show up late to a session or a client shows up late or leaves early, whatever time is verified over in that session or SOAP note comes back into Aloha and updates the times that we bill what the SOAP note reflects. It also completes the appointment for us, which lets us know we're ready to go to billing. And the session note itself is going to be pulled into a URL link here that I can click on. It'll open up Ensora for me and take me directly to the SOAP note. If I were to take a peek at billing, my billing information is in the billing tab. RBT supervision per the BACB requirements is also tracked in the supervision tab if I would like to. So in my schedule, I'm done. I didn't have to come in as a BT and do anything. So now we're going to hop on into our billing area, which is where your biller will start to scrub the information and actually send it out. The first area that your biller will come into is the billing manager screen. In Billing Manager, this is going to be where they scrub and submit all of their claims. So they're going to select their payer and select the date range. When they hit generate, all of the unbilled appointments will populate. Over on the left, Aloha does do a pre-scrub for you, seen through these colored checkboxes. Green is great, nothing's missing. If we had an orange checkbox, I can hover over it and it tells me what I need to adjust. So in this case, my rendering provider was not in. I can come in and actually just add it into this screen. So it makes it easy. Anything in blue text, I can change or adjust. So if I were to scroll over here, I can get a feel for what it is that I'm looking over. All of this should be pretty clean at this point because we have a huge emphasis on onboarding. Once you feel comfortable with this information, you'll just select the appointments you want to bill and click Process Billing. This will pull it into a claim form and send it to the clearinghouse. We have clearinghouse integrations with Office Ally and Availity. So depending on how you set up your system, it would have connected at this point. We would have processed billing and it would shoot it over and actually bill out your claims to that respective clearinghouse. Once those claims have been billed, they'll then be sitting in the AR Manager section. So AR Manager is going to be where all of your outstanding balances live before you get paid. Payers are on the left, balances are on the right, and then everything is broken in the center based on aging buckets. Current is showing us anything less than 30 days since billed, which is where our buckets are living now. If I were to click into that balance, I can see a list of claims that make up that balance. If I needed to call and check on a claim, I can click the clock tool. It gives me claim information at the top, and I can add myself notes at the bottom to a transaction log. So it automates notes, and there's a way for me to actually put in things like reference numbers. Inside the claim, if I were to click into it, I can then see the charge lines that make up that claim. So my AR really nails down exactly what's outstanding. I can also always run reports on this if I needed to. When I get paid, my payment center comes in. ERAs from the clearinghouse do automatically pull into the payment center. You'll be able to view the ERA in Aloha. You can auto post the ERA in Aloha, which essentially means the software reads through what was paid to build, auto post it for you line by line of that ERA. It also transfers client responsibility as appropriate in that auto post. We auto post at 85% of ERAs in full. It'll let you know if something cannot be auto posted. From this screen as well, you can manually post. Maybe kiddo comes in and hands you a paper check, or another payer is paying you through something outside of an ERA. You can match it to what's outstanding. You can also always generate invoices from this screen for things like school district payers, private pay, super bills, verification forms for your regional centers. So that's going to be how we're tying our billing in together. That is going to conclude the demonstration for today on how your team would use both systems, from seamlessly creating your auths, your schedule, to jumping in and actually collecting data, creating your session notes, your SOAP notes, and then walking our way through the billing system.
Okay, guys, I hope you enjoyed the demo. We are going to pop back in to talk a little bit about getting started and then our Q&A.
Yeah, well, thanks so much. I think that was great. Well, now that you've seen the power of the integration in action, excited to announce a couple exclusive offers. I know for Aloha ABA customers that are interested in Ensora data collection, we're offering 2 months free of data collection. So limited time offer. Make sure you take advantage of it. You can learn more through the link here. I know that'll be in the chat as well. And for Ensora data collection, or I'm sorry, for Aloha customers interested in Ensora data collection, they also have take advantage of the limited time offer, 2 months free, and feel free to schedule a demo. That'll also be linked in the chat. And sent after this webinar as well. But both of these offers are really designed to simplify your practice operations. So don't miss out on this opportunity. Make sure you also check out the handout section that has a little bit more information and kind of goes into a deep dive as well. And I think we can go ahead and sort of kick off the Q&A. I'll pass it to Tina and Angela to go ahead and get us started there.
Okay, I am going to start off with the Q&A. We had a couple of questions that came in actually in advance. We had a section where you can type in a question when you registered. Thank you for submitting those, for those that did. We also are going to look at the Q&A that is within this webinar. So if you are still typing out a question, we will look at those as well. Okay, so to start with the questions that were sent in advance, the first one that we received was about generating a payroll report from Aloha. So yes, you can generate a payroll report in the Aloha system. You're essentially going to be putting in all of your pay rates for each of your staff members, whether that's hourly rates. If you have multiple hourly rates, you can put in billable, non-billable drive time, whatever. Mileage reimbursement rates if you reimburse per mile, salaried rates, etc. And then we do generate a nice, clean payroll report in the system. Let me show you a sample one of that. And this will essentially give you all the info that you would need to actually plug it into your payroll processor. Okay, let's see here. Okay, so here is what a payroll report sample will look like. So again, staff are going to be listed on the left, total amounts are on the right. In the center, it's broken up based on whatever sort of earning codes that you might need within your org. So 1 hourly rate, we have a good sample at the top. If you have multiple hourly rates or mileage, here's a sample for that one. And then your salaried employees as well. Super easy, super simple. Okay, our next question that we received in advance was, can we track RBT supervision for the BACB requirements in Aloha? Yes, we do have an RBT supervision tracker. It's actually going to first be seen inside your billable appointment in Aloha. You'll be able to put in who you're supervising, and it tracks the overlap of the BCBA's appointment to the RBT's appointment. Then you can run supervision logs in Aloha and see where you're at with that 5% requirement. Let's see here. Let me pull in a sample of that RBT supervision log. I'll reshare my screen for you. Okay. Okay, so here is what like an RBT supervision log will look like. So it'll list out all of the appointments that you had noted in that overlap. And then it also lets you know on the bottom where you're at with the actual requirements. So your percentage and have you met all of those additional requirements per the VACV. Okay, another question that we received was about generating reports in Aloha. So yes, we do have a ton of reports in the Aloha system. Essentially, everything that you have in the system has a corresponding report, which is awesome. Let me scroll through what the reports here look like, and I'll kind of just chat with you about maybe some popular ones as we're looking into them. Okay, so our reports icon over on our toolbar will bring us to a list of all of the reports in the system. So we have quite a few. Any scheduling information you can pull from your Aloha report list. So maybe just general appointments themselves, cancellations, we have those. You can also pull it per staff or per client. Of course, we have all of our billing and payment reports. So things like your billing ledger report. We have payment reports as well, which we'll get to when you get to those Ps. We have our client information reports as well as auths, any AR information that might be in the system. So aging details, those are those payment reports. We have specialized payroll exports as well. So maybe you see a payroll export that would coincide with the payroll processor you may use. Lots of different reports here. Again, corresponds with the data that you have in the system. These are all viewable in Aloha, but you can also export them to Excel at any point. So if you needed to export them out, send them off, or manipulate them in Excel, maybe create a pivot table, you're able to do that. Okay, pulling back up my question list, there was a question that we received that asked about sessions being sent automatically from Aloha to Ensora. So essentially they were asking, do I have to click a button to have an appointment send over to Ensora, or does it auto send when you are creating the appointment in the Aloha system? So it'll auto send. So essentially what would happen before you even get to the schedule is you would be syncing your clients and your staff. So because your clients and your staff are synced on both Ensora and Aloha, it will automatically send an appointment or a reoccurring appointment when it's created in the Aloha system. So no additional clicks needed, which is awesome. Integration setup, if you are interested in getting started with the integration and want to connect the two, we have an awesome customer success team at Aloha that would be able to help set that up with you. Angela, I know there's a few from the Ensora side as well. Do you want to hop in?
Yeah, absolutely. So one of them that was sent to us ahead of time was how will we build our programs, add targets, write instructions regarding the programs, are the graphs cumulative, line graphs, etc. So I'll actually just do what Tina did and quickly show the back end just so you can see where that's going to be generated from. I only shared the app in the demo, so the back end is actually where an Ensora data collection that would be set up. So let me quickly share that just so you can kind of see where that would happen, but that would be on the Ensora end. Okay, so I'm already open into a graph. I'll go back a second, but the graphs are very robust. They're going to graph according to your target type. So for example, a task analysis will graph a little differently than a DTT target, than a frequency target. So depending on the target type, it's going to graph in a way that makes sense. And it's also going to show up in the app in a way that makes sense and is intuitive, both automatically. But there's a lot of different options. So if you're doing prompt fading, for example, you could pull response to prompt fading. If you're looking at trials per prompt, you can look at that. So there's a lot of different graph options as well per target type. And then there's a lot of different settings you can pull. So the graphs are very customizable and robust, dependent on the programs. And you can always pull in different insights depending on what you want to see. And then in terms of setting them up, we do have built-in curriculum libraries, which are like goal banks. You can add your own, and you can also add goals from scratch. So you can add in a ton of different detail. And again, like based on that target type, it's going to populate intuitively to the app for data collection and to the graph, dependent on that target type as well. So you can add in a ton of different details like your mastery criteria, your target instructions, specific prompt codes, what have you. So all of that would happen on this end. And then the next question we had here, sorry, let me pull it up. Okay, how will the BCBA sign the note? So there's a couple of options. If they're live with the BT or the therapist, they can just sign it straight from the app, like I was showing in the demo. There's also an addendum option, so they can always go back in, and there's a SOAP Notes tab where all saved SOAP Notes will save per client. And they can go in and they can either edit the note or add an addendum if they want it to be timestamped with their signature. So they can review it and add their signature from that end as well, so that web portal that we were just on. So yeah, they can go through that. And then another question I saw come in is, can we give an example of the SOAP note for a 97153 direct service, and will it pull all of the data in? Yes, I just pulled one up. So let me just share my screen again here. So this is just an example of a completely saved note. All of the templates are completely customizable. You're going to be able to, all of these fields are optional to pull in, and you can have multiple templates per therapist type. So for 97153, for example, you might have, and this was the way that we labeled it, so you can label it in whatever way makes sense to you. It could just be called like BT Direct, whatever is easy to bring up. And then all of these were responses that the BT filled out when they completed the note. So some of these were multiple choice, some were multiple select, some were free text, some were signatures with date stamps, some were location based. And then the behavior data and skill data will automatically pull in based on the time collected. So all of this behavior data here, as well as skill data with each program, like information and summary for that session, automatically pulled in upon saving that SOAP note. Awesome. I think there was one more question. Okay. Oh, there was one about invoicing. It would still be separate between our two platforms, so it'll just be invoiced separately. And then, were there any others on your end, Tina?
I am not seeing any others on my end.
Okay, awesome. If any come through, if anything does come up for anyone after this, any questions, definitely feel free to reach out. But we will be sending out resources following this, as well as the ones that you saw in that handouts tab. So definitely reach out if you want a further demo of either platform or interested in signing up. Thank you so much for joining. I hope everyone has a great rest of your day.